Is it a stroke or not a stroke? Chicken or egg? But here's a 3-step approach to help you. Number 1 is hallmark features. Stroke presents with specific signs. Stroke can be divided into total anterior circulation stroke, partial anterior circulation stroke, lacunar anterior circulation stroke, and posterior circulation stroke. TACS presents with dense hemiplegia, homogeneous heminopia, and a higher cortical dysfunction, swallow or speech difficulty, dysphagia or dysphasia. Patients are acutely unwell, confused, drowsy, with a high mortality rate. PACS presents with 2 out of the 3 that we mentioned. They appear better and have a better prognosis. LACS is a small stroke in the smaller blood vessels in the basal ganglia. They present with milder, pure motor or sensory disturbance, dysarthria or ataxia. They usually have a good recovery. POX is brainstem infarct. If the patient has ipsilateral cranial nerve palsy and contralateral motor or sensory disturbance, think brainstem infarct. Number 2 is the clinical context. The vast majority of ED referrals to stroke team with a negative review and CT head are stroke mimics. A stroke mimic is when a non-stroke acute pathology presents with stroke-like symptoms. For example, sepsis, especially in a dementia patient, hypoglycemia, metabolic disturbance, weakness post-seizure with TOS paralysis, meningoencephalitis, functional neurological disorder, or hemiplegic migraine. So think of the clinical context. Stroke recrudescence is a bit harder. This is when an acute pathology causes worsening of an old stroke symptoms, such as sepsis causing worsening left-sided weakness from a previous stroke. This is important because in addition to the negative imaging, the stroke-like symptoms will get better as the acute pathology resolves. And thirdly is disproportionate signs. Stroke chameleon is even harder to diagnose. This is when the stroke hides behind the acute pathology. As a rule of thumb, if the acute pathology is resolving but the stroke-like symptoms persist or worsen, then think of stroke. For example, in a patient with an explained fall due to an infection, the infection settles but they still have truncal ataxia and can't mobilize unaided. In a patient with TOS paralysis post-seizure, they still have weakness days later. In a patient with sepsis, despite the sepsis recovering, they still have ongoing weakness. Think stroke. As a rule of thumb in medicine, if the signs are disproportionate of the clinical context, then think again as a doctor with a red alert. Now I hope the chicken or egg situation has turned into an egg. So practice, practice and practice, and don't forget to subscribe. All this filming has made me hungry. I'm actually feeding an egg actually. Oh wow, it's hot. Ooh. I need some stroke. Oh no, sorry, salt.